The other thing that I wanted to talk to you about that we've been working on is a locally developed program. So this is sort of, it's completely in its pilot stage, is what we call the Autism Family Navigator, or the Family Navigator to be a little bit broader. And this is something that we started working on with our clinical service a couple of years ago. We started out essentially by trying to sort of map some of the needs. This was a completely responsive project to things that you heard about this morning, that we have a lot of discussions about as well in our community, is families struggle to access services, even when those services exist and it's their obligation to take these families. So we started out by asking ourselves, let's take sort of a rights approach first, right? So in our province, what's our vision for autism? And here I think we were quite struck by the abundance of guidelines, policy documents, all very beautifully constructed to describe with great care what services should look like and all their nice responsibilities. Lots of charts, lots of time and money spent into the development of them. So this is where we want to be, right? So we already know that we're in a province that gets it. Our policymakers are not lacking an understanding of the daily struggles of families. They get it, right? And they put it on paper. If we ask, where are we now? The picture is very, very problematic. So here are some of the data that we pulled out. So the first set comes from our diagnostic centers. This is a little bit outdated, but at the time that I prepared those, we had 240 families on a wait list for diagnosis in our own hospital center. And some of them might wait up to 2 years to get a diagnosis. Okay? I think after we started complaining about that, things got reshuffled a little bit, and those numbers are lower, but still by no means what we can call acceptable. Some of you might be familiar with the National Pathways study. You guys have part of the population here. So these are 400 Canadian kids who were followed from the time of diagnosis. I have the pleasure to work with the Montreal team. And essentially what one of the recent findings in Pathways alluded to is that around the time of diagnosis, close to half of the families don't have access to any form of services, right? And this is not specialized services for autism, obviously, because they don't have a diagnosis yet. This is things like preschool, general support from your community center. They had no access, zero access to services, about half, right? Dr. Savion Lemieux, a psychologist in our team, investigated what accounts for this seemingly extremely high percentage of families not accessing services, and found that 71% of those not accessing services fell in low-income categories. Okay? So this is, again, public sector data. The services are there. In theory, they're accessible. But if you are a family with low income, you're going to have serious trouble getting there. And I'm going to let you sort of let your imagination go wild, some of the barriers that you might encounter in accessing these services. Finally, we still struggle with this idea that what's seen as an acceptable type of intervention in our province for autism is restricted to ABA. And that's not a problem in itself, except that it makes us less open-minded to thinking about the broader needs of these families and the different types of interventions that they need, and that maybe an equal amount of time and thinking needs to be going towards not just scaling ABA services, which are currently serving only a small minority of those affected by autism, but what else do those families need, and why are they having so much problems accessing the care that they deserve and that their rights are essentially consistent with. And of course, the idea is that you cannot access even ABA unless you have a diagnosis. So we have this kind of common trend of the family being referred. They're on a wait list for diagnosis for several years, probably after having debated with their doctor for several years to give them a referral in the first place. And then by the time they get to the diagnostic center, there's sort of a cap at early intervention that's, at 5 years, you're no longer eligible. So kids fall off of the eligibility criterion while waiting on these different services. There's lots of community efforts to deal with that. I mean, this is a very well understood problem, and essentially we've tried to explain it using other data and by showing our hospital centers the rise in cases that are being referred for autism and the stagnant amount of support that diagnosticians are getting, right? So like our referral numbers look like this, our service counts are about here, right? So obviously you're going to develop a wait list with that, and to get rid of it, one has to sort of match that demand, which people had not been as responsive to as they should. But there's many initiatives going on at the moment to deal with that. So what we wanted to think about is how this data can feed into the development of this family navigator. So we didn't invent the concept of a navigator. You know, these like nice documents that I showed you, all the policy stuff that exists, it actually mentions a navigator. It says that families affected by autism need to have access to a navigator who is in turn helps them and supports them in accessing these services. We're just having great difficulty finding these navigators. And when we do find them, they are people who sit at a desk with a pile of files this high, who almost never come into direct contact with the families, which obviously is not quite what a navigator concept is supposed to be. So we sort of took it upon ourselves to say, okay, well, let's within our sort of small little world of diagnostic center start developing concepts around what would it take to train a family navigator, and how could we use all the knowledge that we have now from this research to address some of those gaps and barriers. So again, I think we you know, generally speaking, a navigator in our definition, which we very much built on existing literature, not in autism, but in other areas, because our health system does have navigators for other conditions who, according to the research evidence, are being extremely effective and really, really worthwhile the investment in. So we're trying to sort of take the best available evidence and match it with the needs of the community that are expressed in some of the data I showed you. And in our definition, essentially, a navigator is particularly useful around these points of transition, right? Because we know that that's when families are going to experience the most uncertainty, when there's going to be a change in service provisions, and so on and so forth. Right? So we're starting here around the age of diagnosis, but that doesn't mean that the same framework or model can't apply to these other transition periods as well. But it's also very important in our model that navigation is a time-limited thing, right? As is the case with all interventions, because we don't want, not only because that makes it sort of a testable model in a research study, but because we also believe that families at some point, the goal is for them to be empowered to do what it takes to take care of their families and children, right? So we don't want the navigator to become the point of reliance. So the navigator is not somebody who does things for you. The navigator is somebody who does things with you until you're able to take it from there. And talking about what outcomes we're looking for, so the two things that we're measuring in deciding whether navigator is effective or not is whether they empower caregivers and provide better care continuity than we have at the moment. And we're in the process of either borrowing or developing new measures to think about these. Obviously, there's going to be a lot of characteristics that might impact, so whether a child has severe functional problems versus not, whether the parent has mental health difficulties or not, are going to end up moderating how much benefit you can gain from a navigator. But these are the types of questions that will be important and really good to address in research. To just show you some of the initial work that we did, this was supported by Autism Speaks. We tried to sort of put figures to the different kinds of barriers and unmet needs that we see in these families. So these were relatively older kids, but I just wanted to kind of highlight here, again, some of the common ones, lots of them mentioned this morning. So language barriers, financial barriers, the fact that there's a wait list, and then difficulties of the caregiver themselves that are sometimes completely, to our shock and surprise, undetected by people like social workers, right? So we had actually, our most severe case was a mother who was suicidal, whose social worker did not detect the suicidality because the social worker spoke French only, and the mother is an immigrant who spoke not great English, but the social worker essentially refused to do anything about it, and we had to call the doctor and explain the situation. And these types of sort of cracks in the system can be very, very severe and very, very problematic for these particular groups.